people have basically nothing to do all day. क्योंकि लोग घर में हैं, स्कूल बंद है, कॉलेज बंद है, यूनिवर्सिटी बंद है, businesses बंद हैं. Offices are running, but they've been running at lower strength since the beginning of the lockdown around March 21st or so. So, एक तो ये है कि काम भी नहीं है. Some people are working online, but working online is still a relatively new concept in Pakistan. So all of that is generating. बच्चे सारे घर पे हैं, all that. So all of that is generating some stress, obviously. There is a financial stress clearly, which is because of businesses being closed and all kinds of economic activity being shut down or reduced significantly. So the economic shock or the economic problems are not unique to Pakistan. That's of course a global problem. It's happening all over the world, including in the United States. और तीसरा जो है उसमें ये है कि एक तो हम बात कर रहे हैं ना कि जो लोग आफ्टर द लॉकडाउन या कोविड से रिलेटेड जिनको प्रॉब्लम्स आ रहे हैं, कोरोना वायरस डिजीज से रिलेटेड प्रॉब्लम्स, एंजाइटी, स्ट्रेस जो कुछ भी है, सो वो तो अपनी जगह पे है. बट ऑफ कोर्स लेट्स रिमेंबर दैट बिफोर द लॉकडाउन स्टार्टेड, बिफोर कोरोना केम अलोंग, Pakistan in particular had a very high rate of mental health issues anyway. So हमारे पास research तो अच्छी नहीं है पाकिस्तान में. There's very little reliable research. लेकिन जो थोड़ी बहुत research है वो indicate करती है कि common mental illnesses like depression and anxiety. So in Western research in America, UK, Europe, the prevalence of common mental health conditions like anxiety and depression might be anywhere from 5 to 15% of the population. In Pakistan, it's easily double that, and some studies, so small studies that have been done. We don't have good population-based studies, but the small studies indicate that it could be as high as 30%, 40%, 50%, especially in women, because of the various social reasons. So anxiety, depression, and of course, drug abuse is an issue. So the mental health problems so बहुत पहले से चल रहे हैं, and the high incidence of and by the way, this high prevalence of mental health issues is common to most countries, or similar in most countries which are economically underdeveloped. So many countries of Asia, most countries of Africa, the incidence of the prevalence of mental health issues is higher than economically more developed countries in generally speaking. दूसरा ये है कि हमारे पास mental health professionals की acute shortage है. So, again, we don't have good numbers, but by one estimate, the total number of psychiatrists in Pakistan is less than 500, which works out to about one psychiatrist to 1 lakh people or less than that. When the recommendation by the WHO is one psychiatrist to about 10 to 15,000 people. Same with psychologists, same with the mental health nurses, various other mental health professionals. So, proportionately, the qualified people who are trained to deal with mental health issues is very, very low in Pakistan. And the incidence and the prevalence, the occurrence of mental health illnesses is very, very high. And all of this is before Corona ever happened. अब ये हो रहा है कि क्योंकि because of Corona, because of the various issues related to that, the incidence, the occurrence of mental health issues is really going through the roof, including in a very important group, which is healthcare professionals. So doctors and nurses and paramedical staff in hospitals who are working, taking care of Corona patients, are also suffering very, very high levels of stress, anxiety, depression for various reasons. They're afraid of getting infected. They're afraid of infecting their family. Some of them are getting sick. All of those things. So, वो एक ऐसा group है, which is especially vulnerable group, which we particularly need to protect and care for because they're the backbone of our healthcare system. अगर doctors and nurses और paramedical staff जो है, वो overwhelmed हो जाएगा, तो फिर who's going to run the healthcare system, right? So we have a whole sort of like a perfect storm of mental health issues, which is just starting. So in the next 1 month, 2 months, 6 months, a year, we are really going to have a huge problem. And again, this is going to be a global problem, not just in Pakistan, where the occurrence of mental health issues, even before Corona came along, the WHO figures which we have indicated that the prevalence of mental health issues all over the world is rising, is extremely high. And now with COVID, with the illness itself, with the economic problems, all of those things, we are anticipating that there's going to be a huge spike in mental health issues, and we are not very well prepared at all to deal with that.